Now we talk with Cologn Germany. Thank you. Discussing about what's happened with our residents.
Thank you. Guten Morgen. I am so happy to be with you here, and I would like to talk about the COVID-19 effect on those young doctors. In March 2020, everything changed when we faced COVID, an unknown disease, and we asked these young doctors to take care of those patients when they don't know the disease, if they're gonna die or not. So they took a great responsibility in this scenario. So impact of COVID can be talked on the responsibilities as a doctor, is psychological impact, and with respect to education. These ophthalmology residents were assigned to COVID clinics. The ophthalmology clinics were closed, and they took care of the COVID patients like in internal medicine doctors. And even they were assigned to ICU clinics, and they take calls in that. These are our residents taking, calls in the ICU clinics. Here's one of our residents telling what he thinks about this. Can we open the sound? I can't talk for him. Anyway, so he tells about his anxiety working in ICU clinic, and he was alone in the ICU clinic and didn't have anybody to ask for. So this is very stressful, and I wish you can hear from their voice, but let me tell. And they say, I didn't come here to see a dying patient. I asked for ophthalmology. Never thought a patient would die in front of me. So these are stressful moments. So they visited houses, they vaccinated people, they were on the streets, and the studies show that those people, the residents were under depression, they had anxiety, they had insomnia. But their motivation was high. You see the picture, and they were thinking that this is a fight against the human fight against the disease, and they were involved in their country's fight. So this was another aspect of being a doctor. So even if the situation was hard, they had their willingness to put their best to take care of these patients. So what about their education? The studies have shown that if we divide it into two, like the didactic and surgical practice, the didactic practice was somehow goes on with the web-based information, but the surgical practice was bad. It's significantly worsened with the reduced number of the patient care, and they had the anxiety for their professional future and compromise in their training. So also their research, their theses were affected. None of the patients were coming, so they couldn't do their researchers. So that was another aspect that we face with their education. Okay. How we come over these problems, still we can't hear it right. How we come over these problems, we let them work in the ophthalmology clinics at the same time with the COVID services. So they had some time off from their COVID ICU clinics, and during their time off from the ICU clinic, they came to the ophthalmology clinic and worked with us. So this kept their motivation high. So now they think that their education was not affected that much as they thought that they would. Now the studies also have shown that these are the surgical volumes, how they are affected during COVID time. The cataract decreased 20%, refractive surgeries 20%, and vitreoretinal procedures decreased 15%. They were the most that were affected. And this is the comparison of the number of cases that they are doing compared to their minimum requirement for a resident and what they get during COVID time. These orange dots you're seeing in here are the percentage of that they cannot take, they cannot do during the COVID because they're all at the negative side. They couldn't do their minimum requirements for their residency. And here, what have changed with the COVID, you see those lectures, those journal clubs, they were all decreased because they were all face-to-face. But what was increased, what the web-based education, web-based didactic education, also with the simulator, they try to catch up with the surgical skills. And here you see, it's a survey involving many countries in here. So the survey, like 32 countries, the end result is their didactic teaching was not affected, maybe minor, but the surgical teaching was affected. But with the web-based education and with the simulators, they caught up with the education. So those new ways of teaching, web-based case presentations, web-based discussion, edited surgical videos, and simulation-based training are here to stay. We are still keeping those, even though we return to normal. So we thank to our young ophthalmologists, and when they return back to normal to our clinics with the higher volume of patients, they are catching up with the surgeries, and they are doing even more than they had done previously. So the still web-based training, I guess, will be staying with us. Thank you very much for your attention.
Thank you. And because we are in a streaming